have the same haircut. Let me see it one more time.
Squint your eyes and look far away.
No, that's not pink.
Okay.
Not even close to pink.
I'm going to say, Tiffany says it's not pink. Who is that?
Okay, you might be offending this person. Can you imagine if somebody posted a picture and was like, Jennifer said that's not Sandra Bullock. Who is this?
Those are always out. People, the guys like, there's the guy, everyone thinks he's The Rock. He's like, and they're all taking pictures.
I've seen it. All the drunk girls.
Yeah.
Yeah.
The best one was this picture that this guy posted. And he's like, all the ladies say I look like Chris Hemsworth. Have you seen that one?
No.
And he puts his picture next to Chris Hemsworth, and then Chris Hemsworth replied, and he's like, this guy's trying to trick us by posting the same picture twice.
Oh, that's cute.
And I'm like, oh my God. And he doesn't remotely obviously look like Chris
Oh, really?
No.
Oh, so he was being sarcastic?
I don't know what he was doing, but I died. I thought it was hilarious.
That is hilarious.
I have to say, the mood from both of you today is
No, I was thinking
very
that
nice.
about you.
Me?
Yeah, both of you. I was thinking you both seemed like you were in a great mood today, but I didn't want to jinx it.
Now you killed it.
I know. I know.
All right. Let's get
Red button.
Oh shit. Thank you.
That doesn't make any sense.
We'll just sit and wait on Meredith now.
Yeah, no problem.
Sorry. Okay, I got a podcast related message. We have a meeting today, by the way, if you'd like to come.
Oh, okay. I was gonna say I can't.
Okay.
With who? With any of them. I can't with anybody today. I'm so busy.
Are you? What are you busy doing?
I'm getting my hair done. I can join from the hair chair.
You know, you did that last time just as a...
It was tattoo. It was a tattoo.
Yeah, you were getting a tattoo in the middle of our podcast management meeting.
Oh, it's the same people?
Yep. And now you're going to be sitting there with foil on your head?
Shit.
I mean,
I look like I live a really cool life. How do you catch me the 2 times I leave the house?
How bougie are you?
I'm literally not. I sit on my couch 7 days a week.
All right. So let's go ahead and get started. Now, people are going to be confused because they're going to hear the live podcast because I think Phil said one went out. I think the Buffalo show went out. And people are going to get really confused because those are scripted and there's more of a format and a flow. And then they're going to come back to listening to the regular shit and be like, fuck. Because, I don't even remember the intro. And we did it 4 times 2 weeks ago live.
Yeah. Is Buffalo the one where I talked about going in the bathroom?
He edited that out.
Shut up.
He did.
I love him so.
Do you want to hear what he said? Hold on.
Wait, is it going to hurt my feelings?
I don't know. Maybe.
Okay, then don't tell me.
I've uploaded the Buffalo show and the latest home episode. I edited out the quote scat story because ew. And he says, remember, ladies, we're still selling these shows with ads.
Phil said that? Phil.
I choked on my own spit when I was laughing reading that this morning. And I loved it. Because that's classic Phil. That's classic Phil. Listen.
Is it? Because I don't know Phil that well, but he knows a whole lot about me.
He is. That's Phil to a T. He's great. Because I text with him because of the show.
All right. Well, can you thank him for taking that out? Because I really regretted it.
Did you though? because it was a great story.
I regretted it. I
I
regretted
regretted it immediately as it was coming out my mouth.
Yeah. I regretted it immediately. Oh, that makes me feel great. Okay, so people are going to be listening to this and they're going to be like, "Wow, you guys are fucking losers."
Well, hold on. So let's intro the show, because then I have a question and we can ask the audience that's here, and then we, listeners, once this episode airs, can give us their input on it as well. But Phil posed a very interesting question, so let's get started. Welcome to Take It or Leave It. I'm your host, Meredith Masony.
And I'm your host, Tiffany Jenkins. This podcast will discuss all things marriage, motherhood, and everything in between. Please remember, we're not professionals at anything you may actually need. So any advice we give, you can take
or leave, because it might be crap. On today's episode of Take It or Leave It, we are at home. So format, who the hell knows what's going to come out our mouths? But the live show podcasts are going to start rolling out. But Phil posed a very interesting question.
Okay.
He said, I want to publish shortened live videos to keep them special and entice the audience to buy tickets. So he said, should we only give the full episodes to like the supporters, your Patreon, your Substack? That's an interesting question. I didn't think about that. Should we have two versions of this? A shortened one that goes live for everyone, and then one that is special that like the supporters, it gets posted. The link for that one gets posted in supporters. I don't know how that would work, because once it's published, I don't know how you make it only for a certain audience.
No, you can do that. You can upload a video that's only for supporters.
Well, it wouldn't be a video. They didn't all have video. We only have video of those two shows, and we're not getting more video.
Upload the audio is just for, you can do a post that's supporters only.
What do you think, Tiff?
I think I'm down. As long as we didn't I feel like, so they'd still be getting an episode, just not like the uncut version.
It basically be, it basically would be the he says shortened version, so I could get more details on that. And then somebody in here just said, I thought about that. If you release all the shows, people may not buy tickets. I saw the Hartford show, so I, of course, want to see the previous ones, but I worry about future shows. So there are, some ideas behind that. Now, the way I look at it is every podcast is different. Every topic is different. Every audience is different. The vibe is different. The things we talk about are different. So it's not the same show. So if you say, well, I listened to the Hartford show, so I'm not going to buy tickets to the Kansas show. Well, Kansas is going to be totally different.
Right.
So to me, it's like, these are all going to be different. If you enjoyed it, because we even had some ladies that were at the Hartford show that were like, if you come back up here, we'll go to Boston.
I think that the people who are going to want to come to the shows are people who just want to come to the shows. I don't think they're necessarily coming for the content specifically. So I don't think if somebody wants to come to a I mean, of course they're coming for the content, but I don't think anybody who wants to actually come to the show is going to be like, no, I'll just wait for it to come out on
Spotify or whatever.
I don't know. I mean, I'm down. I don't see why not.
Yeah. So we'll talk that through. But I found that to be an interesting point that he was making, because, you have to remember, he listens to literally every podcast as he's editing these, and he makes good points. Right. So we'll have a chit chat about that. But, the thing that I loved about being on the road with these, and that I'm excited about for the upcoming runs, are just, it is so completely different each night.
Mm-hmm.
I love that. I know that scares the shit out of you, and it's the worst part for you, but it's my favorite part.
Yeah.
So anyway, all right. So we'll circle back on that. And I'll make sure that you get invited while you're sitting in your chair getting pampered.
I'm looking at my under eyes, and I'm very displeased with this angle today. Okay. So can we talk about something?
Yeah.
And I know that I've talked about this in the past, but it really does feel like the first time I've ever said this. But it's not. But so I've gained weight and my weight always fluctuates up and down 10 pounds. It's up right now. And it's so crazy how knowing that I'm in the bigger version of my body has made me want to stay indoors. I don't want to be in photos. Like people were trying to take pictures of me. I don't want to take pictures. Like I feel I can't even look at myself is how I feel. So I went back to the gym for the first time.
Nice.
The day before yesterday. I went yesterday.
Nice.
And I joined a fitness challenge, which has to do with like exercising and drinking water and eating healthy. And you get points for all of it. And I'm going back today.
Nice.
And I have been having some behind the scenes work done. No, not work done, but like on my blood, like blood work done.
Do you want to talk about your blood work today?
We can. I didn't know if it was, I don't have much to say really, other than what the plan is, but the point is I got blood work done and I found out some things. Basically my liver needs some loving.
Mm-hmm.
Which is not surprising. And that was a nice way of her putting it. That my liver is a haunted house.
So let me stop you before we go down this road. So everybody here knows, if they've listened at all for the last year, that I went to get a hormone panel with Joy Wellness in November, literally a year ago, and came back and found that I was severely deficient in testosterone, had some issues with my thyroid, had some issues with progesterone, was completely estrogen dominant. And so I started therapies with them because of my imbalance. Now, as well with that, they test you, they do a complete metabolic panel. They're checking for your, like you just mentioned, liver enzymes, kidney function, cardiovascular health, your risk for diabetes, your sugars, your A1C, all of these things, right? It's a complete 360. Is that the right way to say it?
Yeah.
Overview of your health. It's like this snapshot, and then they break things down, right?
Mm-hmm.
So I have been nagging you since November of last year and been like, you should go do a full workup.
Yes.
And it took 1 year.
That's not that bad.
Of me nagging you.
I feel like that's right on track.
And yeah, you're not wrong. And you finally went to Joy. And well, why don't we start with your blood work?
Do we want to start there?
Go ahead.
From the beginning part of when she came to my house?
Yeah. What happened when the phlebotomist came to your house?
She was taking my blood, cash, at the kitchen table.
Cash.
Super cash. We were talking. Apparently we're the same age, but she looks 15. So I was like, bitch. I was like, good for you, dude. Like, what's your routine? Blah, blah, blah. She's like, I've got so many kids. I don't know how I look this young. And the conversation was flowing. We were good friends. And we were in the middle of talking about something. I don't remember what it was, but she said, are you okay? Which was such a weird thing to say in the middle of our conversation. And I was like, yeah, I'm okay. And as I said that, I was like, oh, actually, I feel a little lightheaded. And she's like, it's probably because, and that was the last thing I remember. The next thing I remember, my eyes open, her arms are under my armpits, and I'm like convulsing. And she's saying, let's get you to the couch. So let's get you to the couch. And I'm like, okay. And then the next thing I remember, I'm on the couch with my legs propped up, an ice pack behind my head. No clue how any of it got there. And I open my eyes and there's a stranger in my living room. And I'm like, wait, what's going on? Did I effing pass out? And she's like, you did. I had to give you ammonia, smelling salts, or whatever you call them.
Oh, wow. She had to use the, where they break the thing and rub it under your nose?
Well, no, it was like a wipe. or something. She didn't have the cracky, because she said that. She's like, I wish I had the regular stuff. It was like an ammonia wipe or something.
Yeah.
But the point is, she had time to do all that. And to me, in my mind, I was getting my blood drawn, and then I came to sit on the couch. It took less than a second. But in that time, so much happened. It was so crazy. And so it really freaked me out because I am a recovering addict. I was an IV drug user. Needles are my middle name. Like, you can't scare me with a needle. I was basically a phlebotomist to myself. So I couldn't comprehend why that happened. And a doctor friend of mine stitched my video that I made asking people WTF and told me it was something called vasovagal syncope.
Dr. McSteamy.
He actually is steamy. He was in a 90s boy band.
He is attractive.
Oh, wait, you know who I'm talking about?
Yeah, I saw I saw his IG reel of your vasovagosyncope thing. Is that whatever it was called? Yeah. Why are you looking at me? I said he was attractive. He's not.
Tell him he's not your type at all.
He isn't my type. He's just he's just like, you know how you can look at somebody and you know that they are what's the word? Traditionally attractive.
Yeah.
Like, he is traditionally attractive. So not my type, but traditionally attractive.
Super quick sidebar. Meredith, no one's ever attracted to Meredith. The only two people have both been doctors.
Okay. I feel like you didn't mean for that to be offensive, but I'm offended. There's lots of people who are attracted to Meredith.
No,
I'm one of them.
She doesn't find other she doesn't find other people attractive. She goes, I've never find anyone attractive.
I don't.
The only
so wait. I thought he said no one finds you attractive.
No. The only two people she's ever found attractive are both doctors. So she's not allowed to go get any more medical.
Oh, okay. I misunderstood.
No, so there was so when Brian was little and we were taking him in to figure out why he wasn't walking, and we had seen orthopedists, we've seen, obviously the pediatrician, we had gone to some other doctor, I don't remember. And then the last referral is neurology, because that's like the last, like, you're going to find a solution before you get to neurology 9 times out of 10, but we found no solution, right? So we end up at children's pediatric neurology. And this doctor was like, walked straight off the set of Grey's Anatomy.
Oh.
And was like and he's a pediatric neurologist. So you're just like,
he's good with kids.
Hi, doctor.
Wait. Is this why I had to drop Brian off at daycare while he had a neurology appointment?
What are you He was a nice guy who was married, and I just liked looking at him. That was it. And he was taking care of our child.
Okay.
So
all right, back to
anyway.
passing out.
Okay, yeah. So after this, remind me to tell you about another doctor story.
Okay.
So anyway, that was really jarring, but that happened. And then really shortly after I got my results back, I was surprised at how quickly I got them back, because it was like from my house to whatever. And I guess my insulin levels are through the roof. And I was a little bummed because my testosterone wasn't bad enough to get whatever you got. And I even asked, I'm like, could you just
I just have some
just break me off a little tea?
That's not how it works.
Yeah, I know. I was like, I'll slip you a 20. You just slip me a little tea. I said, no, she's like, what's your diet like? And I'm like, whatever, lady, why are you being so confrontational right now?
Right. The doctor. You said that to the doctor. Okay.
I don't know why you're yelling at me. But yeah, I was like, I don't know. Like this week, it's pretty much Taco Bell. But like last week, I was eating salads and shit. Like, you just depend. And so then she's like, exercise. And I'm like, okay, this is an assault, I feel like right now. And so I felt really dumb, because she's like, what's your mother's medical history? I was like, she was good up until she died of cancer. And she's like, what kind of cancer did she die from? I was like, lung cancer. And then she's like, how did your grandma die? I was like, lung cancer. And she's like, how did your other grandma die? And I was like, lung. lung cancer. And she's like, okay, so you don't smoke, right? And I'm like, no, I don't smoke. Technically, there's no smoke. I vape. I do vape. And she's like, we need to get you to stop that. That could have a lot to do with your circulation problems, blah, 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 blah.
No.
Yeah, so I hung
This
up on
is
her.
my surprised face.
Yeah, you're a surprise face.
Okay, sorry. Dave is giving me this stop. He's saying stop it.
I think he's saying get closer to the mic because you're not even anywhere near it.
Oh, no, I don't think that's
Like
what
I
he's
can't
doing.
even hear you.
You can't hear me?
No, it's like so low. Oh, my earbud was falling out.
Oh,
Sorry.
Jesus.
Like you're feigning away.
And anyway, so what else did she say?
Anyway, she said my liver's screwed, dude, which is not a surprise. See earlier statement about being an IV drug user. So I have to do like a liver detox or whatever. And I'm pre-diabetic, which okay. And so we came up with a plan for me. And I guess they're going to be shipping them out and we're going to see how they go. And I've always felt really uncomfortable talking online about health stuff and like ever talking about like medications. I always try to be really careful because a lot of my audience is recovering addicts. So I never want to promote that. I've never wanted to promote that. But the way that you speak about this company and the way that even in private, like there's no cameras anywhere. And you're like, Tiffany, you need to do this. It changed my life. You have to do it. I'm like, I know that you mean it. Not that you're a bullshitter by nature, but just the amount of times that you've brought up this effing company. So I'm looking forward to seeing what happens. I really am looking forward to getting healthy again, not having a dry heave when I go up the stairs, like trying to put socks on is starting to get difficult. My knee joints are screwed. Like I'm in my big girl era and I'm looking forward to controlling what I eat. So a lot of the shit that's wrong with me apparently can be fixed with diet and exercise, which is not what I wanted to hear, but I'm going to give it a try anyway.
Hey, so one, I'm also pre-diabetic.
Oh, what's up?
Yeah. Not good.
Besties. No.
So I want to go back to something you just said.
Can you?
Something you just said about, your earphones falling out again?
I don't think they're falling out. I think
I was far away. I was far away.
Okay, yeah.
Your socks. Have you ever realized how far away your feet are? I told Meredith, I just realized it probably a month or so, maybe a month or two ago. Your feet are so far away. I am so tired of having to reach all the way down to put shoes and socks on and off.
Dave,
it's exhausting.
I asked you not to say that publicly.
I've honestly been trying to figure out how to solve this problem.
They have it
because it's disruptive to me.
But it's for elderly people.
It is disruptive to my day and my mood. I'm not kidding.
I know. That's what makes it so funny.
Dave, it's not.
I think we were in a hotel and I was like, oh my God, they are so far away.
They're not.
Could you imagine if I was 6'6"? I'd never change my shoes. I just leave them on and sleep with them.
That sounds like something someone who's high would bring up while trying to put socks on. Like, dude, did you ever fucking notice how far away our feet are? They're like 6'1" feet away.
6'1" feet away. I lost video. Why does that keep happening? Yeah. Yeah. So I've asked you not to publicly make that statement. And now that you have.
It's so funny.
I'm looking at comments and I'm hearing Tiffany, and I am not the only one that suffers from this.
No, I got your back, Dave. I'm telling you, like, it's a lot.
I've already been thinking about ribbon colors for the condition. Like,
oh my gosh, Dave.
We just need to pick a month.
What is it? Farfoot syndrome?
Like, we just need to pick a month.
FFS.
Okay. FFS. Do you suffer from FFS? Do you sit on the edge of your bed and think, dear God, how far away are my feet? Stop it.
Can I tell you a story that goes along perfectly with what we're talking about?
Yes.
This is crazy. I apologize if my supporters have to listen to this again because I already told them last night, but I haven't talked to Meredith or the podcast about it. I might have talked to you. I think I did vent to you about it because you were involved, but I'm going to tell everybody else because this is a big moment in my life. My daughter, as a mom,
yeah,
I know what my daughter looks like. I know how she walks. I know if something is off with her. I can just tell it's my kid. So for almost a year now, I've been trying to point out to people how weird my kid's walk is. Now, I'm not trying to be a dick about it, but I ask specifically, do you see it looks like she's limping? Do you see it looks like she's doing a hobble? And nobody ever like validates my shit. They're like, no, she's fine. And I don't know, maybe they're trying to be polite and not but I would videotape her from behind, which sounds weird, but like while she was walking. And then later on, I would watch the video to just confirm like, this is not normal. Even her dad, I would bring it up to him. So finally I couldn't shake it. Like there's something up. So I made an appointment at the pediatrician for her. And it was the pediatrician had her run down the hallway and walk and was like, yeah, it looks like she could have an abnormal gait. She's definitely flat-footed. Let's refer her to an orthopedic, whatever, bone doctor. I was like, bet. Well, the appointment for the bone doctor happened when I was out of town. So Drew had to take her, which I know he was like sighing and rolling his eyes because our entire marriage, I would bring up these medical situations that never came to anything. It was always me making shit up most of the time, like in my head. So it was like one of those things where he had to entertain it. So he went, he took her, he called me after. I was waiting with bated breath to be validated. And he's like, nothing's wrong. And I was like, what do you mean nothing's wrong? He's like, the doctor said her walk's a little interesting, but there's nothing to be concerned about. They did x-rays. Everything is fine, Tiffany. And so I couldn't fathom that. Like I couldn't accept it. Like everything was not fine. She used to be pigeon-toed with a little bow-legged. Now she was walking with her right foot like shifted outward and like whatever. So I couldn't believe it. And I was in denial. And I was so pissed because I was like, I look like an idiot again. And I couldn't take it. So I called the orthopedic people and I'm like, hey, I was out of town. My ex-husband took my daughter to an appointment. I just want to confirm what he said was accurate, that nothing was wrong. And they're like, no, we're looking, we x-rayed the foot, everything's fine. And I was like, okay, just out of curiosity, what foot did you x-ray? And they're like, we x-rayed the left foot. And I was like, oh, okay. Because it was her right foot that was the problem. It was her right foot that's on the paperwork. It's her right foot that I told the doctor, and the doctor, when they sent the referral over, they said it's her right foot. You guys x-rayed the wrong foot. And I was like, I'm not paying for that again to have it redone. And they're like, yes, you are. And I was like, that's fine. But let's do it anyway. So I took her in for her appointment the day before yesterday. They x-rayed the right foot and she has to have surgery. This poor baby has been walking around for almost a year with something called tarsal coalition, where it's basically a bone that doesn't belong there. And it's growing over the part of her foot that makes it twist like this from side to side.
How does that happen? Is it injury related? Like an injury occurred, or you're born with it?
I believe it's something that you're just born with, and it's hereditary. I don't know. Her dad had to have some kind of surgery on his ankles. I don't remember much about it, but yeah. So I've been it was so valid. Now I'm not happy that she has to have this surgery. I'm really sad, and it's hard and it's sad for her. But when I tell you that phone call to my ex-husband was the greatest phone call I've ever made, to be like, hey, motherfucker. No, I'm just kidding.
Well, it's validating. You were completely vindicated of the
yes.
There's nothing wrong with her.
It's very ego driven of me, and I understand that, but it was almost a relief. Like, okay, now we know how to fix it. I could tell, like, and Chloe, dude, her arm was broken for 3 months before we found out. Like, she could have the craziest shit happening with her and just carry on as normal. And I knew that. And so anyway, it was really, and also I'd like to clarify that my ex-husband wasn't a jerk about it at all. He was just not as afraid as I was. You know what I mean? And that's fine. But it was the way that I don't want to talk shit.
I get it. I do. I hear you. We did the same thing with Brian when he was little. He had this he broke his heel. I think I may have told the story when you talked about Chloe's arm, and it was weeks before we got him into the doctor because he didn't complain about it, but he wouldn't walk on it.
Mm-hmm.
And I mean, he broke literally. His heel was like this, and there was a crack straight up the
so crazy.
And he didn't complain. He didn't cry. And the kid had a literal break in his heel and then was casted and everything.
I think
it's sometimes it's really hard.
One thing that I would say, Tiffany, that I noticed, two things. One, I've been going to more and more. I've always been going to appointments with Meredith. And have you ever been to an appointment with a man, like that the man was the patient?
Yes.
So one of the things I notice is that doctors talk differently to me than they do to her. When I go into an appointment, I can say whatever I want. When she goes into appointment, she gets talked to. I'm sorry, she gets talked at. So it's interesting.
That is interesting.
It's interesting to see that. So, when she says things, she'll come back and she's like, they told me I'm fine. I was like, if they tell me I'm fine and I don't want to be fine, I say I'm not fine. And they say, okay, what's wrong? What can I do next? Mm-hmm. When you say you're not fine, they're like, no, you look fine. Anxiety. You look fine, go home. Right. That was my next thing that I was going to say. So one of the things that the idea of
Dave, they said they can't hear you.
He got closer. We can hear now.
Okay. Sorry.
So the idea of somatic pain, right? Anxiety manifesting as physical pain. I think one of the things with doctors is that they're going to hit the target more often if they stay down the middle with what normally shows up, right? Normally it's not an issue. Normally it's this, normally it's that, whatever. And if you're speaking outside of the norm, they're like, no, you're just wrong. It's going to likely be this anyway. Let's go down this path. I know some of the things with Meredith, she has physical pain, right? And she'll go in and they're like, nothing's wrong. It's like, I don't think you don't have pain, right? I think some of it is manifestations of anxiety and stuff like that. And your body turns it into physical pain. But the big thing is, it sucks because like like I said, I told her, your appointments are different than my appointments. And that really came clear to me because then I had the reverse experience once. And I was like, well, that kind of sucked. I didn't really get to say anything. I was just kind of told what it was. I'm not having that. And anyway, so just you're not crazy.
Thank you, Dave.
Yeah, it's so I just had my 3-month follow-up with Joy, because you have to have blood work done every 3 months depending on the medications that you're on. And because I'm on testosterone, I have to have my levels checked every 3 months. And so I've had 4 blood draws. I've been there a year, so I've had 4 blood draws, right? So on this last one, and I haven't talked about this yet because I don't want to worry people, because technically there's, probably nothing to worry about. And if it is something, it's something that can be fixed, most likely. But I had a high. So I had some new things on my blood work that I hadn't had before, meaning like new testing done. And I don't know why these things were ordered. But the doctor read my results and said, just so you know, your prolactin levels are high. And I said, okay, I don't know what that is. Is it bad? And she's like, well, you shouldn't have this much prolactin because you're not breastfeeding, and you create high prolactin levels to feed babies and like make milk and, do all of these things. And you're not, doing that. So we need to figure out why your prolactin levels are so high. And so I said, okay, well, like, what are the symptoms of high prolactin levels? And she's like, well, did you have menstrual irregularities? And I was like, yes. She's like, did you have fertility issues? And I was like, yes. She was like, did you have, and I was like, yes. And she's like, oh, so your prolactin levels have probably been high for many years. And I was like, well, what does that mean? And she's like, well, I think you need to make an appointment with your primary care physician for further testing because you could potentially have a tumor on your pituitary gland in your brain. So 9 times out of 10, they're benign. They are growths and they cause you to, they're called prolactinomas or something like that, where they cause you to create this excess of prolactin. And so I asked her, I was like, okay, I was like, should I be panicked? And she's like, nope, but you definitely want to get further testing because in your chart, you've had esophageal tumors, you've had skin cancer, you've had you grow things, like my body grows stuff, right? So there could be a tumor on my pituitary which it also causes thyroid issues. And my thyroid levels were off again as well. And so my thyroid levels have been increasingly getting worse over the years. So I was like, okay. So she goes, what I would do next, she's like, because we are your hormone specialist. They're all physicians, right? But she's like, I need you to make an appointment. So I made an appointment. I went in and saw my primary care doctor. First thing he said to me was, you look great. I was like, thanks. I had high prolactin levels and my thyroid is wonky. My hormone specialist said that I should get an MRI of my brain. And he was like, well, why don't we just retest your blood? And I was like, well, because I just had it tested a week ago.
Yeah.
That's my level from a week ago. And he's like, yeah, but that can fluctuate. And I was like, well, here are my hormone level or my thyroid levels. And he's like, yeah, let's retest everything.
Ugh.
So I was like, okay. I said, that's absolutely fine. I'll go in and get my blood work done. I want an MRI. And he's like, I don't know that they're going to let me give you an MRI because really an endocrinologist would be the one. And so I was like, then get me to the endocrinologist. And he's like, well, the wait's going to be really long. It's a specialist. And I was like, okay. I said, answer this for me. Does high prolactin levels have anything to do with the thyroid? And he said, yes. And I said, okay, so I have high prolactin, I have thyroid issues, and I grow growths on my thyroid, which I have to get scanned every year. I said, there's a connection. I want an MRI. I want you to scan my thyroid again. And you know what else they told me high prolactin causes?
What?
Dense fibrocystic breast tissue, which is why I keep having to have those repeat mammograms. I've had 3
Holy
mammograms
shit.
this year. So I was like, let me get this straight. It also causes fibrocystic breast disease. I was like, I literally have all of these fucking things. So I said, and I was very calm because the second you start to you raise your voice or whatever, they basically say to you, you're being hysterical. Calm down. This is anxiety. I said, listen, I've hit my insurance deductible. I'm not over here freaking out that I'm dying. I do not think I'm dying, but I have hit my deductible. I do not want to redo blood work. You then say in December, we should get an MRI. I can't get in. And then January 1st, I'm paying $2,000 for an MRI.
Yeah.
I said, I want the MRI now.
Did he do it?
So he gave me a script for an MRI, a thyroid scan, and I have to have another mammogram because when he looked, the diagnostic was done 3 months ago, but it was only of one breast, and I have to have both breasts done because when you have fibrocystic breast, you have to have them done like every 6 months. So he wrote me another mammogram. So Monday, he's given me antidepressants twice. This doctor, has somebody asked in there, and I've attempted them and had terrible side effects from them and stopped. So anyway, on Monday, I literally go to the hospital at 1:00 and I have a mammogram, a thyroid scan, and an MRI in a 3-hour period. So
do you get the results right away?
I don't think so, but I called the endocrinologist's office, which is who's going to have to get this result of the MRI. And I told them that I'm doing it on Monday. And they said, we won't schedule you until you have the MRI done and you have a result. And I told her the same thing. I was like, listen, I'm going Monday. I need to get an appointment because I've hit my deductible. And if there is some like issue that is going to require like expensive treatment, I need to get it done now. Like if I have a fucking tumor on my pituitary and you have to go in and take it out, that has to happen before December 31st because I'm not paying this in January.
Right.
Now, what I did some research on it, and there is medication that you can take that can shrink them and your symptoms will fade. So it's like great. But I literally, for whatever reason, they tested my prolactin this time. And who knows how long it's been elevated.
Wow.
Because it literally hits like a million of the fucking things that I've been dealing with.
Right.
So I was like, okay, what?
So someone just mentioned that pituitary issues can affect the esophagus. And it does.
Does it?
Yeah.
What does it say?
That it's a study that I'm looking at where they said 49-year-old male, essentially they found a pituitary mass they found a esophageal adenocarcinoma.
Yeah.
And in the head CT found a pituitary mass that confirmed it. So
Did it say what kind of pituitary mass he had?
I don't know. No idea. But there was a correlation between that.
Yeah, it apparently, so your pituitary is what controls all your hormones.
Meredith, you're not even.
What? What?
Sorry. This is what you sound like. So your pituitary glands are in your hormones. Like
because
so far away.
He's fixing it. Yeah. So they deal with hormone regulation, which clearly I've had hormone issues my whole life, imbalance.
Can I ask really quick? I want to keep talking about this, but can I ask why your microphone is the way that it is?
What do you mean?
Not that it's triggering my OCD or anything, but I'm just wondering, like, it's completely sideways and you're talking into the side of it.
Is it like, bad audio?
You sound far away.
It's because of how
she doesn't like it right in front of her because she says it looks.
Yeah, but can't you instead of Meredith, instead of it being like this, which is how you had it, can't you just angle it? You had it like this.
I can't. It's
sorry. I'm so sorry, everyone. It's me. I'm the problem. It's me. This is a lot. I thought it would be an easy fix.
How is that?
Ooh, smooth like butter.
Sorry about that, guys.
Oh, okay. It's so much better, Meredith.
So we did that before because Meredith shouts down the barrel as well.
Yeah, she does.
Mm-hmm.
Wow.
I don't know. It just feels really inappropriate.
Yeah. No. Don't shout down the barrel. Save that for later.
Wow. So what if this was the answer to everything? That would be horrible if that was the answer, actually, if you had a pituitary on your brain.
No, everybody has a pituitary.
Yeah, for sure.
Mm-hmm.
Is that your third eye?
I don't think so.
And fluoride blocks it?
What?
Nothing.
So that was Jeba's neighbor, not Pink.
100% not Pink. 100% not Pink. I can't believe both you and Dave.
I was like, that could be. I don't know. It doesn't not. They have literally the same haircut. So that's not really fair.
But their faces?
Yeah, because then I looked at this one up close and I'm like, it doesn't really look like pink as much as probably Jeba's neighbor.
That's so funny.
She's like, I saw my neighbor there, you weirdo. Oh, sorry.
Oh, wait. So it was at a Pink concert?
Yeah, that's
okay,
why
well,
I
then
thought
that's
it
not
was
that far
pink.
off, Mare. It's not that far off. It makes sense why you'd think that. All right. It's not as crazy.
I didn't think she just randomly sent me a photo and like, oh, you saw pink on the street. Like
100%.
No.
I thought that's where we were. With this.
Yeah. Anyway.
All right. Well, you have to keep us all posted. I want to set an alarm on my phone for after your appointment so that I can know.
Well, you won't know because they're not going to read me the radiology report on Monday. So, I will. The only thing I'm going to do is as soon as I leave on Monday, I'm going to drive over to their office because it's literally next door to the hospital and be like, I just did my MRI. I need to do my blood work tomorrow to try and get it done. Because they won't, for whatever reason, although I do have my other blood work I can fax to them. But I'm going to tell them like however long it's going to take radiology to read it, I want an appointment. Like it's coming to you. I want the appointment because they wouldn't even give me an appointment over the phone. They were like, nope, not until you do your imaging.
Will you be like my mom?
What?
Will you talk to doctors and stuff for me? Because I feel like you're really good at talking and getting what you need. And I'm inspired by you advocating for yourself. Truly, like, I think it's amazing. They would have told me, well, let's just do more blood work. And I would have been like, okay. And that would have been it. Whoa, you know what's so weird? Side note, I'm sorry, this is stupid to talk about on the podcast, but I'm looking at my tattoos right now while I was stretching and look at the bottom of both of them.
Yeah.
One of them's a bat, one of them's a galaxy, but they look kind of similar at the bottom.
Yeah, they're pointed
and shaped like bats.
Yeah.
Anyway, I think it's really inspiring that you did that. I would have given up the first time and not argued and not advocated for myself. I would have been like, okay, this was a waste of time.
Well, so here's the thing that gets me is I have been told so many times that there's nothing wrong with me and that I'm healthy. And after I continue to poke and go in, 9 times out of 10, they fucking find shit like the esophageal tumor. My gallbladder had gone bad. Like my uterus was full of endometriosis. And it's like and the problem is it's years of pain, years of problems, years of issues. Literally, when my OBGYN called me after my hysterectomy and she was like, I was in doing your hysterectomy and I thought, oh no, I removed a really healthy uterus because it was nice and pink on the outside. But after I got the pathology, it was full of adenomyosis, which is internal endometriosis. And I was like, I knew it. I was like, I had the worst periods from age 14 until I had it removed at 38. And everybody just told me to shut the fuck up and suck it up. And every month, well, 2 times a month until I started birth control, I had 2 periods a month, 7 days each. So I bled for 14 or to 15 of the 28 days in a month, 30 days.
Oh no.
And I was like, and nobody believes you because they look at you and they say, well, you look healthy.
I don't think anybody's ever looked at me and said that, but I get what you're saying.
Can I ask you a question? And I don't know if you've brought it up on the podcast, and if you haven't and you want Phil to cut it out, we can. But you've talked about your weight and you've talked about your struggles with your weight. What age did that start for you?
8.
Okay, so this is from a very early age.
Oh yeah. When I was young, I was a latchkey kid. My parents weren't really around. They were working and stuff. So nobody was there to monitor the snacks that I ate. And that was my first drug of choice was food. Like I had no off switch. And I'm a binge eater. I have a binge eating disorder. I've never been technically diagnosed with it, but I don't have to be to know how grotesque and disgusting I can get. when it comes to eating. Like there's so much shame around it that I wouldn't even like ever admit what I eat when I'm binging, because their jaws would drop open.
Do you not get full when you're in that mode? You don't
Nope.
have the feeling, your brain doesn't tell you stop?
Nope. It's never enough. It's never enough. As soon as I finish, I'm like, I want more. It's like the feeling of having something in my mouth. I can't explain it, but it's and it's been really bad lately, and I don't know why. And so I talked to my psychiatrist about it the day before yesterday, and I talked to the Joy Wellness people about it also, and I admitted what I was eating. So yeah, so hopefully I'll be able to get some answers. Hopefully the gym will help. Once one thing starts going, then it kind of snowballs into, not snowballs, I shouldn't even say that. Like once I start working on one thing, everything else falls into place. So once I start focusing on going to the gym, then it makes me not want to binge eat and undo all the work that I did. So then I start eating healthier. And once I start eating healthier and the sugar leaves my body, then I stop craving it as much. And then I'm good for a while until I'm not. So maybe some additional medicines might help. I don't know.
So what do you do at the gym?
It depends. The first generally,
I guess my question is, do you go in with a plan or do you just go to the gym?
Well, no. I go with my two friends, and we go in there, and we usually do a circuit together. Sometimes we do a class together. But like yesterday, we were both not feeling it. So we just sat on the bicycles and played Candy Crush and talked. But we did it for 30 minutes after doing arms.
Well, so you were doing cardio on the bike, just chatting. So it was just like a less stressful.
Yeah.
Okay.
So what I would suggest is have a plan that's no more than 20 to 25 minutes.
Hell yeah. I like it.
Because if you go in without a plan, you'll feel like you did a lot of things. You'll be there and you'll be like, I was here for an hour. And then it's like, wait, I really didn't do that much. And then you'll hate going.
Right.
Go in. I'm going to get these things done. It's only going to be 20, 25 minutes. One of the things that we do, or I do when I'm first getting back to stuff, is I play games with stuff. So I walk run is what I call it. Right. I was a big runner. I could go run all day long. Not a problem. So I'll go and I'll say, I'm going to walk for 30 minutes. And then I just set little things and I'll say, all right, I walked for a minute and a half. I'm going to jog for 30 seconds. And then I'll walk for another minute and a half and I'll jog for a minute. And then I'm a pattern guy. So I try to create patterns with what I'm doing. And at the end of the 30 minutes, I've run 15 of them. And I do that once or twice. And then the next time I've run 20 minutes of it. And then I did that for 2 weeks and I ran 6 miles. Like if you do little bits, you're not going to fix it all in one day, one trip. So just do a little bit and then do a little bit the next day. And then it's manageable.
I like that.
The other thing, have you seen that 30, what is that called, Meredith?
The treadmill one I was doing?
Yeah, the treadmill.
That one's really good.
The 30, whatever, you put it on an incline, you walk for 30 minutes, but it's just
12.
It's whatever it is. Yeah.
That
12.
one.
Yeah.
12, 3, whatever.
But you don't ever run. Yeah. It is you're walking literally the entire time, but you're walking at an incline and you have to shift it. And it tells you almost die. It's a really good workout. It will kick your ass and you don't ever have to jog. But like Dave said, start and in not, however many minutes it is, start at a third of that.
Can I request something?
You can request it.
The next time you two are on the road, just hit live and start working out with her.
So you're trying to embarrass me?
I can't work out with her. She's crazy.
Wait, so why would you request that I do it?
It'd be good TV.
I thought we were friends, Dave.
I
get what you're saying. Maybe we can make a video series of Meredith trying to train me at the gym. I think that would be entertaining.
I mean, I know I've
end up punching her.
I've said it before. when she's walking, I have to jog. When she starts jogging, I have to walk.
Yeah, that's funny.
Listen, I love my HIIT classes. They're great. They give you lots of endorphins and good energy boost when you're done. And you get a lot packed into 30 minutes. And we can tailor each HIIT class to do a different, muscle group.
I will never do a HIIT class again. That stands for high intensity interval training.
Yeah.
The first 2 words of that, not my jam. I like lit classes.
Yeah.
Low intensity interval training. You know what I'm saying?
But all right. So anyway, I think it's great that you went, you got your blood done, you had your initial consultation. What I will tell people, because I actually just spoke to Katie, who is the owner, founder of the company. I just spoke to her the other day because I had asked, somebody had emailed me and they were like, hey, I signed up for Joy. My blood work came back really quickly, but it took me 30 days to get a doctor's appointment. And I just feel like that's way too long for somebody to have to wait. Can you tell me why and what's going on? And
wait, don't you make the appointments?
You do, but she couldn't get scheduled for over 30 days. And I said to her, I go, I said, that's strange because when I go to schedule mine on the app, it's usually within a week. Like I'm getting in and I can get an appointment and be seen. So I said, let me ask specifically what the deal is. I said, because that does seem like a bit of a longer wait, but let me figure out why. So when I spoke to Katie, she explained it to me and it made total sense. I had no idea. They practice in all 50 states, but every state has a certain amount of physicians because they have to be board certified for that state. So some of the states have a longer wait because they don't have as many physicians and they have to be licensed, right? Because obviously you don't want anybody practicing who's not licensed for that state because they have to be able to prescribe medication. So some states, like she said, for instance, Hawaii has one provider. She goes, so we are actively working to hire, vet, get more doctors in all of these areas. She goes, but like in Florida, we have so many, it's a 7-day wait.
Yeah, it was.
She's like, New York, 7-day wait. She's like, she's like, Texas, 7-day wait. She's like, but there are certain states that we do not have as many providers. But she did tell me that they're in the process of interviewing and hiring like another 15, 20 physicians. So they are scaling to fix the problem. But that is, and never once thought of that. Never, like it never made sense to me. And I was like, oh my gosh, that makes perfect sense. Like why it would take longer. She did say though, every state has more than an adequate amount of health coaches where if you're in between a visit and you have a question about something, you can talk to a health coach. The health coach can also reach out to the physician if there is some type of issue and they can work it around and get you in. And obviously, if you're having a medical issue, they will work to get you scheduled ASAP. But if it's like an initial blood lab read or something, like, and your state only has 3 physicians, then yeah, it might take 30 days or 40 days. So that is based on.
Is there a way to know?
Yes, what you would do is if you go to sign up and you're doing your labs or whatever, I would literally email them and say, I live in North Dakota. How far out are you scheduling just so I can be prepared? Because who knows how many they have in North Dakota? I don't know. Right. But I'm just saying as a random example, right? So that's what I would do. The other thing is, if you guys are interested in checking out Joy, you can. They gave us a link for the podcast. So it is choosejoy, CHOOSEJOI.co/TIOLI. So you can go over to choosejoy, CHOOSEJOI.co/TIOLI, TIOLI. And right now, this whole month, they're doing Black Friday 50% off labs. So if you want to go get your labs done at 50% off, they're doing, and I highly recommend the hormone and the complete panel if you are like looking for my, like the issues that I've had, right? Because I knew mine was a hormone imbalance. But you could also go in like Tiffany didn't have a hormone imbalance, but she got a complete overview panel that showed her, unfortunately, she's pre-diabetic. So we have to work on getting those numbers to where they need to be. So, but they were just great. Everything about, I've never had a complaint with seeing my physician, and they spend always, 30, 45 minutes going through everything. I never feel rushed. They answer questions, and it's great. So that's just, the spiel if you're interested, because for me, it's been life-changing. I hope for you, Tiffany, it will be the same. I hope that you will stick with it and give it its time, because it wasn't overnight. I would say it took me 90 days to feel like I was leveling. I could see a difference within 4 weeks, but then to say like the tweaking that we had to do, because we had to tweak my dosages and stuff like that, I would say by the 90-day mark, I was like, oh my gosh, I'm feeling like substantially better. And it's just gotten better and better. She is substantially different than she was. Oh, yeah.
Well, good.
Mood, really happy. Everything.
Fingers crossed.
Yeah. So I know if you stick with it.
Hold on. And I don't want to say that from she was so terrible, this, that, the other. She is substantially different she seems to have more confidence in herself than she did before.
Love it. And love that clarification.
So.
I never really looked at it like that.
Yeah. Hey, side note again, let me ask you this. Do you know who Carrie Russell is?
Yeah.
We were watching a show with her, and I said to Meredith, because she keeps talking about boobs, and I was like, she doesn't have boobs, and she's very attractive. And she is attractive in the way that I find you attractive. She's
Say it.
Natural?
In the character, yes, natural, but in the character that she plays, she's a little bitchy, a little demanding, super hot, and fit.
Bitchy and demanding were 1 and 2 on the list.
And she's like, I don't find her attractive. I'm sad that you think that's what I look like. And I was like,
I did not say she wasn't attractive.
You were sad that I compared you to her.
I wasn't sad. I was just like, well, because I don't know. As women, what we see on Instagram is what fucks with your head, because it's like, I'll never be Instagram pretty, because like that's a whole other level of like, you see these women. But now I just keep telling myself, that's AI. That's not a real person.
Yeah, that's the best thing to say. That's what I say all the time. When I get a bill in the mail, I'm like,
no, stop it.
That's AI.
No, what's not how AI works. Oh my gosh, Tiffany Jenkins.
So that was, so she's attractive, right?
Yes, she is.
Yeah. See? Okay.
I like Carrie Russell.
I do too. I thoroughly enjoy her on The Diplomat. That's what we're watching right now. It's a very good show.
Sounds boring.
All right. For you, yeah, I wouldn't recommend it.
Okay.
Yeah, but we are enjoying it.
Okay, good. I prefer her in that movie where she had a bomb go off in her head and her eyes went crazy.
Okay, didn't see that one.
I think it's a Tom Cruise movie.
Oh, like one of the Mission Impossibles?
Yes, I think so.
Oh, okay.
I do. I think so. I was a kid when I saw it, and then like that scene sticks out in my head. They put like a little chip in her brain and activated it, and her eyes went like this. Like it was the craziest thing. Anyways, let's end it on mini bombs in Carrie Russell's head.
All right. So join us next week for another episode of Take It.
Oh no, you know what I just realized?
No.
He compared you to Carrie Russell, and I just said, let's end it with little bomb in her head. And you might have a little one in your head right now.
Oh my God.
That's so sad. I didn't mean to say that. I'm sorry. It was too soon.
Well, I didn't even think about it until you clarified.
Okay, shit.
So thanks.
Damn it. I'm sorry. It's fine.
But no, I'm not. I did look up prolactinomas and they're not cancerous.
Oh, that's fucking great news.
That's what I said. If I have that, if that's what I have, that's why I'm not freaking out. If I have a prolactinoma on my pituitary,
that sounds so weird.
They are not normally by any stretch cancerous.
Okay.
So they have to be treated because it does shit to your hormones in your body. But that's why I'm hoping that if this is what it is, that they can say, okay, you're going to take this pill and we're going to watch this thing shrink and your symptoms of XYZ are going to improve, because that would be like magic.
Yeah, that's amazing. I hope that happens, dude.
Yeah, that's what I hope.
Do you need to be comforted?
I don't need any of your penis comfort right now. Thank you.
Ew. I mean, not ew, Dave, but like ew to penis comfort in general.
That's
like I'm more of a snack comfort kind of gal, which is why I'm so depressed. So none of it works. Fuck it.
Yeah. Well,
anyway, yeah. Join us next week for another episode of Take It
or Leave It, an advice-ish podcast hosted by two struggling moms who have no idea what we're doing. We'll see you guys next week.
Okay. Bye. Love you.
Okay.
Meredith, it's not you. It's the microphone. Something's wrong with